right? So this is data from the Arizona Department of Health Services. Basically shows that non-marital birth, the rate of it has not changed over that 10-year period. So what he said in Our Kids book was that women with a college degree and women with a high school or less have the same likelihood of living with somebody, living with a guy, and not being married. That's pretty much the same. There's no educational difference in that. But what they do see is that the college-educated women are not having children with the guys they're living with, right? But the woman with a high school or less is far more likely to have one or more children with a guy she's not married with, and more likely to have children with multiple fathers. And this is a road to the poorhouse in many ways, because what we see, and you'll see it in later slides, is those guys who are not marrying the women are not necessarily helping the women raise those kids. So I'm going to sound like Dr. Laura here in a bit. Anybody remember Dr. Laura? Not the good Dr. Laura, the other one, Dr. Laura Schlesinger. You know, she always said, know what you're getting into, and I'm still going to tell women, know what you're getting yourself into here.
Oh, but he loves me.
Yeah, exactly. He said we're going to get married someday. So anyway, so this is births to unmarried mothers by education. So that long gray line going up, that's women with high school or less, unmarried births, and the one down at the bottom kind of wiggles around, that's women with a bachelor's degree or more. And so you can see definitely the poor women are more likely to have babies out of wedlock and more likely to be taking care of them themselves. And so one of the things that this really underscores is that we need better P20 education. We need high quality preschool through community college, because the more education the men and the women get, the less likely they are to be on that upward spiral towards having non-marital births. And this is an issue for the kids too, because they've looked at kids who are in blended households, who are, you know, they're going with this father and then the mother, and then, you know, there's other kids from some other dad there, and that causes toxic stress in those children. So this is not, I'm not trying to preach morals here, I guess I'm trying to preach economics, you know. And so, again, we need better education for these kids so they'll make better choices. And I don't know how many of you saw the quote from Speaker Powers in the newspaper about, you know, we don't need sex education, they're going to be radicalized. Well, actually, maybe they're going to have a more sustainable lifestyle if they get sex education and other education on top of high school. So this one shows single parents, right? Like I said, what would Dr. Laura say? Well, you can't read that, but so again, the tan line going up, this is living with in a single parent family by education. So these are children living in a single parent family. Again, high school or less, way up there. It's almost 65%, right? And again, college education, less than 10% living in a single family. So the college educated people have made more of a decision, you know, and made a commitment. They're older, they tend to be over 30, you know. I mean, how smart were you when you were 18 versus when you were 30, right? And so that's what this shows, in my opinion. And this is the kicker. This is the absentee fathers. And so these are fathers with less than high school or less are less likely to be engaged with their children. And so this, the bottom half, this is the high school or less dads. This is the college educated dads and how likely they are. And then this one right here, that black bottom, this is they're not engaged with their children. And so again, they're fathering children that they're not being fathers to. And that's what Dr. Laura would say, you know. And so, but there are a lot of reasons why those guys aren't fathers, right? I mean, like I said in there, how many of them are in prison? We already know that they're more likely to be men of color. How many of them are in prison? How many of them have job scarcity? Are they moving from place to place? I went to an event at Amphi High School last fall. Amphi High School is in my district, and they said that they have a hard time meeting the kids count that the state has on the 100th day, because kids move in and out of Amphi and change schools so much. And I'm like, well, why does that happen? Well, it's because of the evictions, right? So if a kid's in an apartment and his mom gets evicted, they might not be able to find another apartment that she can afford near the school where he's going. So he might, lop over to TUSD for a few months and then get evicted over there and then lop back. And so people are constantly going back and forth. And so this idea of job scarcity, and having to move, or poverty and being evicted, it all plays into how connected the parents are to each other and where they both are and whether they're both even in the same state or the same city. So, and this is a Tucson statistic again. So this is from the census data. So this really shows it, right? 9.3% of the married couples in Tucson are living at or below the poverty rate. 39.8% of the women who have kids living at home. So it's almost 40% for single moms, 9% for married families. Now, when I was running for office, I kept saying, if we really wanted economic development, we would raise these women out of poverty. That's 40% of the people in this town, right? That's a lot of people. And the other thing is, it's like all their children too. How many of their children don't have housing security, don't have food security? That's toxic stress for future generations when we let these women just wallow around and just kind of take care of it on their own, which is what we're doing. And you can see that actually down here at the bottom, 43.7%, it's actually worse nationwide for these single moms than it is here. So we're bad, 39.8, but 43.7 nationwide.
You mean there's something Arizona does not lead the country?
Not exactly leading it. Yeah, we're just.
Well, we're catching up.
Yeah, it all goes into that bubble. The high rent, the evictions, it's all in there. The lack of education, the gig economy. Maybe at some point, 10 years ago, these women might have gotten a full-time job, maybe at Target or something like that. But now it's all part-time jobs. So the other thing too is that these women are not getting the jobs, right? Here again, employment for moms. Again, high education is the dark line. The light gray line is under 30%, or actually just over 30%. And so here we are, we're forcing them to live in poverty. We're not giving them TANF, we're not educating them, we're not giving child care subsidies, but they still can't find work, right? Because they can't afford child care. And so what are they supposed to do? I'm surprised that some of these women are actually able to keep it together, right? Because everything is being put on them. The fathers aren't supporting them, the state's not supporting them, they're not being able to get jobs. And then in 2018, the state said, well, to get TANF, you have to have a job. Well, where are they going to work? And who's going to help them? Because they're not doing anything at the state to help these women out. So, it's not all bad news. Like I said, the percentage of moms under 19 has gone down a lot, 51%. The percentage of moms over 30 has gone up. And so some of these things are good, but we're still seeing far too many babies born prematurely and low birth weight. The state of Arizona did recently get a grant from the feds to look at maternal death, but we have a lot of work here still to do. You can see in the data that there's a disparity about the care that women get when they're pregnant and then also after pregnancy. So white moms are more likely to get first trimester care, which is when you're supposed to start prenatal care. My daughter, if she hadn't had first trimester care, she would not have had the sonogram that showed her that her daughter was going to be born with gastroschisis. So first trimester care is very important to see what's going on. How healthy are you? How healthy is the baby, right? Native American moms are most likely to have no care, no prenatal care. And Native American moms are least likely to have 13 visits total. So what we see is care going down overall. And last year and the coming year, the state of Arizona had a surplus. And there was even an article in the Arizona Central that says, even though we have $1 billion, we're not spending anything on the poor. So, and that was one of the articles I was quoted in, as Joe says. So this one, I decided to look at prenatal care and put the governor's names in there, because you'll see there's a dip when Ducey took over, and every one of these things, except for no care, which goes up when he took over. So,
Yes.
so anyway, I'm not sure exactly what happened there. Now, I don't know. I've talked with people about, you know, what happened with this dip in the data, because you see it over and over and over again at that same time point, 2014. And so was there a law that was passed, like maybe one of those anti-abortion laws that limited access to care, or some sort of budget cut? So I haven't figured out why there's a dip and why it stayed down under Ducey, but you know, that's not enough. 68% of the women getting first trimester care when we have $1 billion extra in the budget. And in the next year, 2020, when we negotiate the budget, I want you guys to all write this on your calendars, we have record revenue again, $19.6 billion coming into the state, and we don't want them to give it away, right? We want them to invest it. Invest it in the people, don't give it away. So anyway, remember this slide. This one shows that it was across the board. You know, some ethnicities were worse as far as access to prenatal care, obviously, but it was down across the board for all ethnicities. Now here is moms who began care late. So this would be third trimester care. Again, so this, late care goes up. Early care went down, late care goes up. And exactly the same time frame. So I'm still trying to figure out what was passed. One of the things that was suggested was perhaps there were new contracts, there was new vendors who were given privatization contracts for care. There's all kinds of what ifs on why that is. And again, it was across the board. People were more likely to get late care than early care. This is no care. No care also went up. It's low, no care is low, but still, it went up and it stayed up and it's still on that trajectory. So this is the curve we also have to flatten out. That needs to go down. And again, it was across the board. So there's, like I said, lots of disparities. Black moms are more likely to have a preterm baby that's less than 37 weeks. And there was an African-American mom at the NICU when I was there, and she had been there. She had actually had to be hospitalized before the birth because she was in bad shape. African-Americans often have high blood pressure issues when they're pregnant, particularly if they're overweight. And so this was this woman's second premature birth. And again, if a woman has one premature birth and it's paid for by the access system, then the state should do everything they can to make her next birth experience go to term. You know, I mean, even if you don't care about the moms and the babies, really, if you want to save money, you know, give that woman some help. You know, she was in there for a good 3 months before Selah was born, and she was still there when we left 3 months later.
Yeah.
And so what's that bill going to be, you know? And how much is she going to have to pay for it, you know? My granddaughter's bill was $530,000 for 3 months in the NICU. And what I've heard from doctors at Banner Health is that the premature babies, Selah was not premature. She had a birth defect, but she was not premature. She was a little bit small, but still almost 6 pounds, right? She wasn't like 1 pound or something. But premature babies, $500,000 to $1 million each. And 52% of those births are paid for by the state of Arizona. So again, we could save money. They like to save money. We could save money by helping these women have a better experience and actually giving them first trimester care, right? And going out to the Navajo reservation in the far reaches of rural Arizona with community health workers and helping these women out, because a lot of people in the far-flung areas. I mean, I've got 3 hospitals close to my house. I live in Midtown Tucson. But at the NICU, again, there was a woman from Jerome with a baby who was premature and had a cleft palate. And when he was up to weight and had taken a couple of bowel movements, they sent her back to Jerome. What kind of services does she have in Jerome? And why did she have to come all the way to Tucson to deliver that baby? Wasn't there a place, at least in northern Phoenix, that would be closer to her house? Or Flagstaff, yes. Well, it was a high-risk birth. I don't know that Prescott's going to have a high-risk birth, but Phoenix would still be closer, right? There were people there was a woman from the Tohono O'odham reservation there, right? And she didn't come one day. And when she came the next day, I said, oh, hey, I missed you yesterday. She says, well, I didn't have the money to take an Uber. She was taking an Uber from the reservation to TMC. It was costing her $20 each way.
Yeah.
And then they sent her back to the reservation with no car and a premature baby. You know, again, why are we doing this? Why are we doing this? So anyway, so in Arizona, African American moms are more likely to have a premature baby. They're more likely to have a low birth weight baby. And get this, they're 3 to 4 times more likely to die from pregnancy-related deaths. And that statistic has not changed in 100 years. 100 years. 100 years. 3 to 4 times more likely to die. You know, that's just abominable. Why are we doing this? Yes, exactly. It's exactly racism. You know, and overall, American moms are more likely to die because what have we been doing since the Tea Party took over, right? We've been cutting Planned Parenthood, we've been cutting screening, we've been cutting money for Medicaid and Medicare. There are hospitals that no longer do deliveries.